and that's, I guess, that's the most we've seen in something like 20 years. So I saw there was one of those ivermectin promoting Twitter accounts yesterday, tallying up all the different deaths from, heart disease and other different overdoses, and they're extraordinary compared to 4 deaths from measles. And whenever I hear people use those numbers like that, I'm like, you ever heard of an exponential curve? And that's the thing about infectious disease. And you heard that a lot at the beginning of monkeypox. People were like, well, what's the big deal? It's only a handful of cases. And like, indeed, we were here when they were complaining about that. It was no big deal. I'm like, yes, but you can see the trajectory. And this is what we don't want. And by the way, all death is bad. And just because we're saying that measles is bad, it's being talked about more because it is a novelty. It is not a novelty necessarily that they're overdose. By the way, overdose have plunged in the last year. The CDC just reported. However, part of the Biden administration's efforts to get that to happen was to promote free Narcan, and that's a program that the Trump administration has sought to cancel. So, all this talk that they're going the MAHA, the Make America Healthy Again, we're going after chronic conditions, which includes addiction. We're like, okay, well, put the money where your mouth is. Like, are you actually spending money wisely? This major women's initiative study, they've been following women for decades. This was a study that found, 20 years ago that actually giving hormone replacement therapy to postmenopausal women increase their risk of various negative health outcomes. Hundreds, if not thousands, of papers have come out of this important study, and then they just stop it and just throw out all the way. All the different data and the insights you can gather from that is these women age into the geriatric age is just lost. And there is a movement to recoup those funds and to keep the study going. But just the thought of the contradiction between what RFK is saying about wanting to fight chronic health conditions and where they're putting their money where their mouth is. They're killing funds for the very things that they would supposedly want to combat.